The stages of HIV infection include acute infection, latent period, and AIDS. Acute infection lasts for several weeks and causes symptoms such as fever, lymphadenopathy, pharyngitis, rash, muscle pain, discomfort, and sore throat. The incubation period is asymptomatic or with few symptoms and may last from 2 weeks to 20 years depending on the individual. The final stage of HIV, AIDS, is defined when the number of CD4 T cells falls below 200 cells per microliter or certain diseases associated with HIV infection occur. Acute infection. The early stage of HIV is called acute HIV infection or acute viral syndrome. Many people develop flu-like illnesses or mononucleosis 2 to 4 weeks after exposure, and others have no significant symptoms. It occurs in 40% to 90% of cases and usually includes fever, lymphadenopathy, pharyngitis, pruritus, headache, and/or oral and genital ulcers. The skin, which occurs in 20 to 50% of cases, shows itself on the upper body and is in the form of sharp spots. Also, at this stage, some people get opportunistic infections. Gastrointestinal symptoms such as nausea, vomiting, or diarrhea may occur, as well as neurological symptoms of peripheral neuropathy or Guillain-Barré syndrome. The duration of these symptoms varies, but is usually 1 or 2 weeks. AIDS-related cognitive disorders, a collection of cognitive disorders. It is a nerve related to HIV infection and AIDS, which usually occur after years of HIV infection and infection. Since these symptoms are not so specific, they are often not recognized as signs of HIV infection. Even cases seen by a family doctor or a hospital are often mistaken for many common infectious diseases with common symptoms. Therefore, it is recommended that patients with unexplained fever be warned that they may have HIV infection and are at risk of developing this infection. Incubation period. After the initial symptoms, the patient enters a stage called latent period or asymptomatic HIV or chronic HIV. This stage of HIV can last from about 3 years to more than 20 years, on average about 8 years, without any treatment. Although there are usually no or very few symptoms at the beginning of the disease, near the end of this stage, many people experience fever, weight loss, digestive problems, and muscle aches. Also, 50 to 70% of people have persistent lymphadenopathy, in which several groups of lymph nodes, except in the groin, are enlarged for more than 3 to 6 months without any pain and inexplicably. Although many people with HIV-1 are undiagnosed and will eventually develop AIDS if left untreated, a small percentage, about 5%, will maintain high levels of CD4 T cells for more than 5 years without any antiviral treatment. These people are classified as HIV controllers, and those who maintain a low or undetectable amount of virus in their bodies without antiretroviral therapy are known as superior controllers or superior suppressors. Acquired immunodeficiency syndrome. Acquired immune deficiency syndrome, AIDS, is defined when the CD4 T cell count falls below 200 cells per microliter, or certain diseases associated with HIV infection occur. They become AIDS. The most common conditions that are a warning of the presence of AIDS are pneumonia caused by pneumocystis, 40%, loss in the form of HIV wasting syndrome, 20%, and esophageal candidiasis. Other common symptoms include respiratory tract infections over a period of time. Opportunistic infections may be caused by bacteria, viruses, fungi, and parasites, which are usually controlled by the body's immune system. This infection can affect almost any organ in the body. People with AIDS are at risk of contracting various cancer viruses, including Kaposi's sarcoma, lymphoma, central nervous system lymphoma, and cervical cancer. Kaposi's sarcoma is the most common cancer that occurs in 10 to 20% of people with HIV. After that, lymphoma is the most common cancer and the cause of death in nearly 16% of people with AIDS, and it is the primary symptom in 3 to 4% of them. Both of these cancers are associated with human herpes virus 8. Many times people with AIDS get cervical cancer due to the connection with human papillomavirus, HPV. In addition, they frequently experience symptoms such as prolonged fever, night sweats, swollen lymph nodes, chills, weakness, and weight loss. Diarrhea is another common symptom that 90% of people with AIDS experience.